And the Surgeon General's call for a warning label on social media is based on what many call a mental health crisis, not only across the U.S., but here in North Carolina. According to the United Health Foundation, in North Carolina, more than 70% of children with a mental health disorder do not get treatment. Surgeon General Vivek Murthy's initiative isn't the only in the works. Our Merritt Morgan spoke to the United Health Foundation about another initiative that the foundation and ECU's telepsychiatry program are doing to combat the issue.
The teen mental health crisis.
There's a greater focus on mental health, particularly given the rising prevalence that we've seen here in North Carolina. I think the data is sobering. 9% of our children ages 3 to 17 years old have experienced either anxiety or depression.
A crisis that faces many challenges.
And some of the challenges that we're seeing, again, nationally and in North Carolina, is that there continues to be a stigma attached to even having open dialogue and open discussion about mental health. And then also we continue to see a shortage in the number of healthcare professionals that are providing behavioral health services, which really means there's an access issue.
Which is why United Health Foundation and the East Carolina University for Telepsychiatry and eBehavioral Health are partnering with a 3-year, $3.2 million grant to combat the issues.
I screened a large number of children, over 10,000. 1,800 showed mild to moderate level of anxiety. So beyond the screening, we are providing services, both therapy and child psychiatry services,
to address mental health issues in teens sooner rather than later.
Most of the mental disorders start early. And about as many as 75% of people who have mental disorders would have had their first episode of that illness by age 25. Anxiety, depression, and when people having difficulty managing stress in relationship.
Through creating a holistic and effective approach when treating children.
Mental health for children includes mental, emotional, behavioral well-being, and that provides the launching pad for how they think, feel, act, and how they handle stress.
That was Merritt Morgan reporting. Dr. Saeed and Backman say that it's vital for those dealing with mental health challenges to reach out to their healthcare provider or call the 988 mental health crisis hotline.